We talk a lot about the exceptional care and treatment that's provided by Catholic Health. Well, their clinical excellence in oncology, cardiology, neuroscience, orthopedics, and etc. is highly recognized both regionally and nationally. But people may not always know how to best access all these fine services. So here to give us a better understanding of the various pathways to outstanding care is Dr. Patrick O'Shaughnessy, who's the president and CEO of Catholic Health. Welcome back, Dr. O. Glad to have you with us.
Monsignor, you know how much I love being with you. Good morning. It's great to see you. Happy New Year.
You
look fantastic.
Feeling good, doing all right. I'll take it.
We're getting ready for the telethon.
Yes, big 2 weeks. I know. Now, I know you're away. You're chaperoning a senior trip with your daughter.
Yes.
That's
oh,
great.
boy.
Listen,
you know, it's going to be a lot of work, but a lot of fun, a blessing. But I used to always love coming. I used to not eat for 2 days before coming to your telethon.
Well, this place is packed with food.
It's packed with food.
Yeah, there's a lot. People send stuff over. Ben's kosher and everything. It's great.
It's amazing. So have a great telethon.
Thank you. We're multicultural.
Yes, I love
it. So now, I think about like my generation of people. I mean, how'd you go to the doctor? You made a phone call, you scheduled an appointment, and that was it. You just waited.
Sure.
Now, if things were really bad, you called the emergency room, you went to the emergency room. I mean, now it's changed so dramatically.
Yes.
It's hard to even understand how much has changed.
Yes. It's one of the things I'm obsessed about. I'm obsessed about a lot of things, but going to other industries and thinking about what we can learn in healthcare and bringing the very best to Catholic Health. As you said, we have the very best of clinical care, quality, safety, outcomes, amazing caregivers. But we wanted to make technological advances and investments to make it easier for people to access care at Catholic Health. And that's exactly what we've done. So the days of just picking up the phone and waiting on the phone to get an appointment are over. We still have, call capability, but now we can do this all through the Catholic Health MyChart app. And we can, through your phone, I mean, think about it, how you order food, how you order a car, how you book air travel. It's all through your mobile device.
Right.
We're leading on this now. In fact, we'll be one of the few health systems in the country to have two-way conversational texting using AI. So we could immediately connect with people and answer their questions, make an appointment, refill the medication, you name it,
now,
we can do it.
Hold on a second now.
Yeah.
Two-way texting now?
Yes.
So like you're texting somebody for advice because you're saying, listen, and I hate to say it, like, what's coming out of my nose is yellow or it's green or this or that. I'm coughing. That's the kind of stuff you're talking about?
Absolutely, and be able to connect in with your provider.
Wow.
So we'll be able to triage that kind of over the digital device and get you to the most appropriate level of care and get you there with immediacy. And that's something we want to really outshine the competition on. We don't want people waiting. We want people to get the care they want, where they want it, and when they want it.
Let me ask you one thing about this, because I have a zillion questions to ask you. So here's the deal. Like, even with renewal of prescriptions, so let me tell you, I'm going to reveal my health situation. I take allopurinol back to the days when Pope John Paul II visited. I had a kidney stone. And it was uric acid.
Uric acid stone.
So I take allopurinol, and the doctor always says to me when I go for my checkup, you don't really have to take that anymore. I don't think, Monsignor, it's been a long time. And I'm like, I remember that kidney stone. I'll take it for everything.
Yes.
Now, how do you renew something like that without having to go make a visit?
Right over the phone. We can do televisits with your provider. So you could actually say you're busy, you got a busy telethon, you can't get to where you need to go. You go right on your phone. You could either schedule an appointment, get a televisit. You could refill your prescription right through the phone.
Oh, man.
Yeah. So these are the kinds of things that, 2 years ago, we didn't have, and even healthcare as an industry didn't have, but we're leading it. So we're making care more easily accessible. And the things that you have to still see a healthcare professional for, you can. You could see them digitally, you could see them in person, but also making it easier for you to get your prescription refilled. If you want to pay your bill, it's 2 clicks and you're done.
Wow.
So you don't have that same clunkiness.
I love that. Now, what about video visits now, too? I read about that.
Yes.
I mean, so we're all over that.
Absolutely. We've led on that. In fact, we had that live even before COVID, but now we've advanced it. So now, depending on your level of urgency or what you need, you can go right in your phone. You can then, download them. Everybody should have the Catholic Health MyChart app. If you don't have it, download it. It's a game changer.
Yeah.
You go to that, you can schedule a televisit, refill your prescription. You can see everything about your healthcare. You can see your record because, maybe you don't need to be on allopurinol anymore, Monsignor.
Right.
Maybe it's been 10 years since you've had a stone.
25.
We can talk about diet or other things to prevent that. But my point is, it allows you as the consumer to be more engaged in your care. And that's what makes Catholic Health special. We keep the patient at the center of everything we do.
Yeah, I love that. What about these kiosks that you developed, these Catholic Health kiosks?
Amazing, right? So think about it. One touch, you go to the airport now. You know, how many times do you really have to go to the counter and see a human being?
Yeah, not often.
No, not often. A lot of times you're doing it on your phone, which you can do with us. But I said, and with our IT leadership and clinical leaders, we said, let's put these kiosks in our ambulatory locations and other offices so that when you can come in, you can do a lot of your pre-appointment work on your phone, and you can just check in on the kiosk, just like when you go to the airport. So it's boop, 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 you're done, you're checked in, you're in the office immediately with the doctor. And when you look at our ambulatory expansion and access points, this was a key piece to making sure people had a seamless, easy experience of care. We now have 22 ambulatory centers that span from Queens all the way out to Riverhead. So when you see the kiosks, use them. They make life so much easier.
It's incredible. I mean, I love that idea because, again, you bog down, and it's enough to go to the doctor.
Yes.
But that's another thing you're working on, which I love, is like entry time, doctor time.
Absolutely.
So like you're not sitting in the doctor's office for 2 hours.
That's right.
Waiting for him to catch up.
Yeah. First of all, we took a real concerted effort to open up access.
Yeah.
The number one complaint I would get from family members, friends is, Patrick, we love Catholic Health. The quality is amazing. The commitment to the patient is amazing. I can't get in.
Right.
So we expanded access. We made it digitally capable, and that you can get in really when you see. We've cut the time to appointments by over 56%. We can get you in now within 3-5 days. Or if you need an immediate visit, you could telehealth. We now have Catholic Health Urgent Care. You could walk right in the door between Center Reach, Ronkonkoma, and about 5 more sites coming with our MedExcel partner. So we're trying to make care more easily accessible for people. Again, care where and when you need it.
And talk about those ambulatory sites, because I think those are important.
They are.
Because sometimes, people say, oh, I have to travel. It's a long... Not necessarily anymore, right?
It's a one-stop shop.
Yeah.
And that's what makes us different. So you walk in, it's the same look, same feel, wonderful people, the high quality you expect from Catholic Health, but at the same time, you have primary care services, urgent care services, and specialist services in many of our locations, all co-located. So I have people who call me up and say, I went in, I had an urgent care visit. They said, you need a primary care doctor. Next day I came back, got my primary care visit. They plugged me in right down the hall with GI. I had my imaging, I had my blood drawn. I picked up my prescription, and I had a great day.
Yeah.
In, out. That's the future. That's what we're leading at Catholic Health.
And I also read, like, even pharmaceuticals you're getting involved in now with filling prescriptions and even delivering prescriptions to it on certain occasions?
We are. We could save patients a lot of money, and it actually saves us money as well. Same quality medications. My CHS RX allows you to get medications cheaper. So in many of our ambulatory sites, we have the capability to fill prescriptions in the ambulatory locations, but then also in the hospitals. Think about it. You're an inpatient. You want to make sure you have everything you need. We actually give our patients their medications they need. It's called meds to beds. So that when they go home, they have a box filled with everything they need, which prevents readmissions and help keeps them better.
Wow. So while I have you, I'd be remiss if I didn't ask you about the one I love the most, Good Samaritan University Hospital.
Yes.
So here we go. We have this little addition here, which is massive and gigantic.
Yeah.
It's like a town.
Yes.
What's going on with that?
It's basically, it's a whole new hospital. We're on track for a very exciting ribbon cutting in December of this year, so December 2025. 300,000 square feet of state-of-the-art space, right?
Incredible.
You think about it, 75 new bay emergency room, 36 private patient rooms, and state-of-the-art operating rooms for our surgeons, beautiful lobby that connects in and makes a seamless experience. It's going to transform the way care is delivered. And getting back to technology, in those hospital bedrooms, we're going to have one view, which is the TV flat screen that allows the patient to interact with their providers. Jeez. They could change the temperature in the room, lower the shades, order a meal, watch movies. It's going to be a challenge for our length of stay because people aren't going to want to leave.
Yeah, exactly.
But we wanted to give people that amazing experience of care. Like I said, the quality is exceptional. Yeah. We wanted to give them a private experience that is second to none.
I mean, most of us are not used to 21st century care, right?
Right.
Let's be honest. We go to old hospitals sometimes, right? But the reality there is that I remember I got a little sneak tour with you one time. I had to wear a hard hat. There's no pictures of that. And interesting, I mean, that whole experience is mind-blowing.
It's a game
I mean, I
changer.
can't even believe, like,
Yeah.
even the patient rooms that you've
Yes.
designed.
Correct.
Like you said, there's also a couch in every patient's room.
Correct.
And I'm thinking in terms of the families. They can visit, they can spend time. And if your loved ones live in Florida, well, they can, FaceTime into the room.
FaceTime right into the room. And we learned that coming out of COVID, right? We said, what can we do to keep people connected? Well, now you'll be able to do that. So Good Samaritan is going to be a game changer for the health system, but we're not myopic to the fact that we need to make other investments in our other campuses, right? So St. Francis getting a major investment, St. Joseph's getting a major investment, Mercy St. Catherine's also getting investments, and St. Charles as well. So really all of the hospitals, again, we hope you never have to go, but if you need to choose a hospital, we want our patients to choose us because the care is best, they have a great experience, and it's a modern, warm plant where I like to say it's a place of healing.
Yeah, absolutely. How about the mobile capability now with the, with the van? I mean, there's something about that that's beautiful too.
It is.
I see it all over the place.
Well, we live our mission every day, right? So our community service and what we do with our mobile state-of-the-art buses, they're really buses. They're out there providing screening visits for thousands of Long Islanders. I'm very passionate about that because the only way we could bend the cost curve, everybody's always, talking about how much we spend in healthcare in this country. Sure. We have to bend the disease curve. So we have to keep people healthier. Yeah. And so many different areas of our population, people, they don't have the resources to get access to care. And they don't know they're pending diabetics, they have high blood pressure, high cholesterol. So we screen them, we catch them. Many of them could actually be enrolled in different types of insurance plans. We actually help them with that. So we try to keep people healthier and, again, keep them at the center of their care.
Unbelievable. One last thing I have to say, I'd be remiss if I didn't. You have done such an incredible job of telling the story that everywhere you look, there's something about Catholic health these days. So you go to an Islander game, and it seems like every goal is thanks to Catholic health. I mean, all of that, the presence of Catholic health on Long Island is something you should really be proud of, honestly.
Well, you know what I'm proud of? I'm proud of our 17,500 healthcare heroes. And the people on my team and the people that lead the campuses, they're the real heroes. Yeah. They're doing the amazing work that our patients feel every day. I have the privilege to just be the voice behind it, but it's really their work, and it's a blessing to represent them and see the health system grow and expand the way it is. It's just very exciting.
I'm so proud. It's ridiculous. I guess you know that already.
Yes, I do.
Well, thank you for being here today. I'm glad you're here.
It's always great to be with you.
Good luck chaperoning.
Oh, boy.
Brings me back to the days when I was at St. John the Baptist High School.
Oh, boy. I tell you, I may need a little therapy after this one, Monsignor. I don't know.
I'll loan you an allopurinol.